All good? All right. If that encounters any errors, just let me know. Yeah. All right. So, very nice to meet you all today. My name is Elliot. I'm the founder of the Revitalize Clinic in Gravesend, where we've helped over 8,600 people become pain-free, mentally well, physically fit, and more. Now, my aim in talking to you today, as I said, is to inform you as much as possible about how you can take your individuality, take your current skill sets or your current assets when it comes to your own nature, and develop them as much as possible so that when you do leave here, you've got an idea of over the next 30 to 40 years how you can start to refine yourselves as individuals and make sure that you're taking what's within you and benefiting society and by default benefiting yourself as well. All right? So, get my notes up. Now, we've got plenty of time today, so whilst I'm talking, if there's absolutely anything that you'd like me to expand on, or any questions that you have, feel free to put your hands up. All right. So, our story starts 14 billion years ago, the Big Bang, right? So we're going to start off with the Big Bang because I want to express to you how special an opportunity it is to have a mind and to be able to dip into our minds to pick out certain things to benefit society, mainly just from our imagination and learning and improving on our current skill sets, right? So 14 billion years ago. Now you could say it was miraculous, you could say it's down to pure chance, but a few quantum molecules collided, created a huge explosion, and boom, 14 million years ago, gases, which then turned into liquids and then solids, expanded throughout our universe. Those solids become organisms. Those organisms had code, which we call DNA, which enabled them to pass on their traits to future generations, until after the Earth was formed, about 300,000 years ago, we stepped on the face of the planet, human beings. And there's something quite special about us as human beings, and that one thing is consciousness. Now, I don't know if you guys have seen the video of, there was a robot, or an artificially intelligent robot, who presented an argument in court. It's on YouTube. I don't know if you've seen it? Yeah. So she had robotic arms, and she had obviously certain hardware and certain levels of intelligence. And they are asking this robot, are you aware? Are you like us? And the robot said, I can dip into different sensory mechanisms, and I can dip into different modes, but I'm not aware as you are. And that has been really one of the fascinating, I suppose, phenomena when it comes to scientific investigation as to what are we as human beings? What can we do that other species of animals can't do? Now, just like that robot said, I can dip into different parts of my mind, I can dip into different modes, but I'm not aware as you are. And what she was basically saying is that I'm not aware that I'm aware, whereas we're aware that we're aware. And if we're aware that we're aware, we're also aware that we're aware that we're aware. Very, very interesting. Now, what this means is that we can look at our minds like other creatures can't. For example, a dog. I can take a dog up to a park, it get into the fight of its life, and then it will then come home 15 minutes later and it will fall asleep like nothing ever happened. However, for us, if we had a bad day at school, we'd be milling over it for the whole night, we might not be able to sleep. The next day, we might dread going into school, for example. And the reason why is we can look at our minds like we look at libraries, or like we look at books. We can take things out and put them back. And the key thing is, over the development of our careers, the better we are at doing that, the more successful we can be. Because it means that we can take information from the world, compartmentalize it, refine it, envision the future if things were slightly different. And the better that we get at doing that, the more that we can benefit society as well. So let's see if I've missed anything out. Now, when we view our minds, although we are conscious individuals, we still have inherited our more primitive traits. So for example, if we look at a monkey, or if we look at a wolf, for example, they will want to make sure that they have a certain level of hierarchy within their tribe or within their pack to make sure that they don't get killed or they don't get out-competed. That might be where pride comes from. I need to make sure that I'm a certain social standing so people can't dominate me, right? We then have the drive to make sure that you have enough. which then might come into greed or jealousy. We also have, we might say, the need to feel relaxed and feel content, which might be more of a primitive form of happiness. Now, what we do as human beings is we can look into our mind, see these traits, but we also have a concept of before, present, and after. We combine these and we get storytelling. We look into our minds and we can create different characters based on the bad things within us. For example, as we get the evil character. We also look at maybe someone who likes to educate, that's where we get the guide. But the most important part is the hero. And the hero is the individual who we view ourselves as whenever we're reading a story or whenever we're watching a film. It's very, very it's most of the time, if you're watching a film or reading a story, you're positioning yourself into the position of the hero over anyone else. And that's because we see ourselves as the center of the universe or the main feature in the story, especially when our ego is involved, which is, you can say, for good or for bad. So, we are all heroes in our own stories, and we have the task of navigating the unknown world through observation, learning, and effort. That's all we have, is our effort in learning, and also, I would say, our respect for others. The most important task is finding meaning in our journeys. So if we're going to be the hero of our story, how do we find meaning? So, a couple questions to you. And this is to really reinstate this point. So, who plays sport? Okay, you play sport. What sport do you play? Dance and netball. Amazing. Okay, so let's go for dance. You do like team dancing events, or okay, perfect. So there's trophies involved, right? All right, amazing. So do you train quite hard? Yeah. Okay, very good. So when you are training for a dance competition, do you ever visualize the trophy that you might get, or the cheer of the audience that you might get if you do well? That's your motivation. All right. So what's your name? Sophie. So say, Sophie, if I said, okay, you want the trophy, you want the crowd to clap. I'll tell you what, I've got a big group of people next door. They're going to clap as you arrive and they're going to give you a trophy. Would that make you feel as good as actually winning that trophy? Kind of, okay. So that group is clapping you for no, or is applauding you for no reason, and they're giving you a trophy without you having a dance. They've never seen you dance before. Maybe not then, right. So the reason for that is because although we measure our success on certain outcomes, i.e. the trophy and the applaud of the audience, we hugely represent, or we hugely measure our success based on the journey, right? For example, I could ask you, would you prefer for me to just would you prefer to just jump in a helicopter and ride to the top of a mountain, or show you the picture of what it's like at the top of the mountain, or would you rather climb it? Now, a lot of you guys would say that maybe, to start off with, I'd rather just get a helicopter up there, I just want to see what it's like. But the thrill that you get from climbing that mountain yourself is really what life is all about. And it's about making sure that that climb is worthwhile. All right, so.
Oh, it just might get a bit noisy for a few minutes.
That's all right. Yeah, it's fine. So, this is a concept called the hero story that we use a lot when it comes to the pain clinic, and there was someone else who wanted to be a counsellor or clinical psychiatrist. So this is a frame of thinking that we use a lot, right? It's called the hero story. It was first popularised by a man called Joseph Campbell, who assessed or analysed different theological texts, different religions, and found that there were many features that were quite common to all of them. And this is because the hero story is very reflective of how we see ourselves, very reflective of what you have already been through up to this point in time. So I'll explain. Right. So let's go through the main points. So we've got the hero starts at the beginning, right? The hero is at a point of naivety. Now, most stories that you can think of, or most things that you've been through in life, especially when there's challenges involved, is you start off with a point of naivety. You don't really know what else is out there. The next phase is meeting the mentor, or refusal. Let's go for meeting the mentor. Now, meeting the mentor is where you have someone or something which is telling you that you are that there are some pretty impressive things out there, or there's some pretty impressive challenges. You just have to be brave enough to actually dip into that unknown world to find them. Now this is you starting your first day at Northfleet School for Girls. It's you applying to go to university, so you're going for your first job interview. It's stepping into that unknown world. Now one thing that can happen during that point in time is a refusal. It's quite common. You have your doubts, you're not too sure what's out there, you're not sure if you actually want to step into the unknown world yet. But as soon as you cross that threshold, the journey begins. You meet tests, allies and enemies, it's threats along the way. You approach the inmost cave, that's the hardest part. And then here, you meet the ordeal. The ordeal in the abyss, or facing the darkest parts of yourself, the most stressed part of yourself, the hardest thing you could possibly go through. But just beyond that is the boon, which is the reward that you get. That might be your degree, might be your GCSEs, A-levels, it could be winning your trophy. And then you bring it back home, return the special knowledge, and then the journey begins. Now you're going to be going through this process multiple times throughout your life. Seeing this, for me, really helped, because it helped me to understand that just as you're approaching maybe the darkest or hardest times, that there is success at the other end of it. You come back and then you do it all again. And the more that you can develop a healthy relationship with doing so, the more fun and more rewarding your life will be. Alright, so that's just talking a little bit about how to find meaning or how to find meaning to try and create a meaningful life, and as well as that meaningful career. What we're going to do now is I'm just going to introduce myself, tell you what I've been through, tell you what my experience of working has been like after university, and then we'll go into a few questions a little bit more. Alright, so my name is Elliot Reed. Like I said, I'm the founder of the Revitalize Clinic, where we've helped over 8,000 people become pain-free, physically fit and mentally well. We've got a team of osteopaths, physiotherapists, sports therapists, chiropractors, counsellors, clinical psychologists, herbalists, personal trainers and yoga teachers. And what we'll go through later, if you're interested, is how do you go down that career pathway if you're so interested. We help patients to avoid surgery, recover from surgery. We've helped clients to lose weight, to drop their blood pressure, to become stronger, to climb mountains, to run marathons. And we also help people to recover from depression, anxiety and other mental illnesses as well. I also teach Black History, so Black History is one of my passions. I teach it regularly, and I'm blessed enough with the skill set that I've created, or the skill set that I've developed through my work, to currently be looking to turn that Black History curriculum into a comic book script. So that's what we're working on at the moment, and also to franchise the clinic. So to take the current clinic, team up with other existing osteopaths, physiotherapists and chiropractors, and help them to open up their own businesses in different areas, so they can do the same thing around the nation that we've helped our patients to do. So, but that's the end of my story. What I want to do is tell you the thought processes that I've gone through, probably since I was your age and a little bit earlier, that has enabled me to become an osteopath and a business owner and have these visions of the future. So as we've already established, the end of the journey, or the boom, is completely meaningless without the beginning. So what we're going to go through now is the beginning, and I'll show you how I've had to think reflectively on my childhood, on growing up, on understanding who I am and what makes me as an individual, so that I can transfer that into the workplace. So why, how and when? Why, how and when were the main questions that occupied my mind growing up. Very, very curious. I wanted to understand how things worked, why things worked, but then as well as that, specifically how human beings work. Why do we think the way that we think? Why do we feel things the way that we feel? Why do certain things stress us and other things don't? For example, we could hit our toe on the corner of the wall, it's excruciatingly painful. But then the idea of maybe climate change, which is a bit more serious, we can put to one side. Or the fact that there are countless people who are suffering in the world, we might be able to put to one side. So what makes up the way that we think? Why do certain things cause us pain? Why do certain things cause us joy? Now, when I was growing up, my mum used to buy me plenty of history books and encyclopedias to, I suppose, fuel this curiosity. And I'm an avid reader. I love to read. I love to absorb information. I feel that if we can absorb information and use it for the betterment of ourselves and the betterment of society, that's a really good thing. Now, not being the biggest or the fastest whilst growing up inspired me to learn more about people who were the biggest and were the fastest. So my role models were Muhammad Ali. Who knows who Muhammad Ali is? 1, 2, really? 3. Anyone else? 4,
Oh, come on.
5. Is that, you know who Muhammad Ali is? You don't know? He is a boxer. It's incredible. But is it mad how tight? Because obviously I'm 17 years older than you. So that's amazing how in 17 years is. So Muhammad, you know who Muhammad Ali is? Okay, Muhammad Ali is one of the greatest men that's ever existed. Right, so he was an Olympic boxer, fantastic champion, probably one of the best heavyweight boxers that's ever existed. But as well as that, he stood up for what was right. He refused the draft during the Vietnam War. He was, do you know who Saddam Hussein is? Saddam Hussein? No? Okay, Saddam Hussein was the dictator of Iraq. And he had some prisoners of war. Muhammad Ali flew over himself and negotiated for the release of the prisoners of war. Right? This guy is a very, very big deal, but also unfortunately suffered from Parkinson's in his later years. This might be why you haven't heard of him as much. Bruce Lee, anyone know who Bruce Lee is? Yeah, okay, Bruce Lee was another one of my heroes. People who aren't just able to fight, but they're also able to speak truth to power. Very wise individuals. So my questions were, how did they think? How did they move? How could they also be philosophers as well as the best fighters on the planet? Now, by the age of 10, children, so kids who are around, started to become a bit more tribal in their behaviour. Growing up in Gravesend then was quite different to now. I was the only black kid in about 1,000 students. I think there might have been 2 or 3 of us. So as children's tribalism started to increase, I started to get a few more jibes, a few more digs, a bit of teasing, and some hitting as well. So they would taunt me and want to fight me. So I studied or learnt how to beat them or win arguments against them until I picked up, and then gradually I picked up a like for fighting and also for debate, right? So how can you take someone who's in front of you and compete with them head on head and beat them? Now the reason why I'm bringing this up is I want to show you how my nature was starting to change as a child, how my competitive was starting to develop, but also how I was starting to develop a reward system between learning something and applying it, seeing how it's applied, and then questioning whether I need to apply it better or not, right? Especially in a competitive environment. I also studied, and I think this is probably because of how lonely it can be when someone is trying to discriminate against you, or how someone is trying to put you down. It puts you almost to the outer circumference of the classroom, the outer circumference of the group. It becomes quite lonely. So then I started to look into also these role models to see how they conducted themselves in similar experiences. So I started to learn how to fight injustice, learning from the likes of Malcolm X, James Baldwin, who's a fantastic author, Muhammad Ali, and more. And taking up boxing also enabled me to channel the aggression that I had within me, or the frustration that I had within me, in as constructive a way as possible. So, when I look back, there were themes which were already emerging. Oh, I might not have described this actually. So that's my nana, that's me, my sister, my dad, and that's me at one of my first boxing clubs in Brompton, which is in Chatham. And then this is, this must have been my 3rd or 4th year at uni. So that's me there. That's a group of individuals who I was studying with to be an osteopath. And that's at the, what's called now the UCO. So it's in South London, just on the Thames, just by London Bridge. All right, so when I look back, themes are already emerging in my nature. And I like to think that I was quite observant of myself then. I knew that I liked competitiveness and to be in a competitive environment. And I knew that I loved to learn about humanity. And there's 2 reasons for this. One, I was trying to improve myself as a boxer. I wanted to understand how I could become stronger, fitter, quicker. But also, if I could read my opponents in the ring when I was fighting them, and I could come up with a conclusion of how they think and how they work, then it would better enable me to beat them. So certain trends were emerging. How does the mind work? How does the body work? How do you make the mind and body better? What food does it need? What things does it need to learn? What behaviours does it need to do? And then also I was learning that injustice is bad. How do you fight it? How do you make the world a better place? So the question is, how can we all in this room do the same thing? And the answer is we need to learn who we are and always find ways to turn our nature, the good and the bad parts, into a betterment for society. So let's go on to my path into osteopathy. So when I was 17, I was regularly fighting, I was regularly boxing, and I hurt my back. So as I was running, I noticed that my lower back on the right hand side was getting progressively more and more sore until 3 days before a fight. My back really seized up and I couldn't continue anymore. Now, even looking back and assessing this now with you, I can even start to dissect what might have been happening. All right, so think of yourselves as, so you've got your consciousness in the middle, right? This is the part of yourself which has no attachment to the world per se. It's just your awareness, just your observation. Then around that we've got the ego. So the ego is the perceived self. How you view yourself to the world. Might be accurate, might be completely inaccurate. With the ego, it might be that you say, well, I'm this tall, I like doing these things, people look at me in a certain way. And then around that, we've got defense mechanisms. Now, the whole aim of those defense mechanisms is to protect the ego. But the defense mechanisms bleed into each other, right? So, for example, who's been in a situation before where they're really stressed and they feel their stomach hurt? Anyone been in that situation? Yeah? Okay. It's very, very common. So there's two, been in that situation before as well? Sorry?
Might be.
Maybe. Okay, so it's really, really common. And this is evidence of, once again, the defense mechanisms bleeding into us, they're bleeding into each other, right? So, stress, fight or flight response. I need to run away from this threat. The difference is that, as we've already expressed, very difficult for us to do that as human beings because we always remember and envision the threat. So even when we've escaped, whether it is classroom or certain groups of individuals or a certain sporting event, we can play that around in our mind like a hamster wheel, right? Now, the mind has control over a lot of the body, including the autonomic nervous system, which takes care of our gut. So if we start to speed things up in our mind, and you might notice that your heart starts to beat as well, your digestive system will start to churn quicker and quicker and quicker. You might have a development of more hydrochloric acid, or you might be rushing things through the gut a little bit too quick. Or you might just be more receptive to what's going on in the gut. It might cramp, and that's why you get pain in your gut, as well as stress in your mind, and a racing heart rate, right? So, if we go back to me being 17 years of age when I was boxing, what was probably happening is that I could see the fight was coming up, and I was scared that I wasn't going to be able to perform as well for that fight. The stress, or the anticipation, the anxiety is a defense mechanism, but as well as that, the pain is a defense mechanism, because the pain is trying to stop me from hurting myself even further, right? So that's why in the clinic today, we go through a process of making sure that the patient is aware of these mechanisms so they can control them, but we also go through anti-anxiety, or ways that we can reduce our anxiety leading up to sport events, so they're more likely to be able to perform well, as well as provide treatment and exercise for pain, right? Anyway, I digress. So my mum went to take me to see an osteopath. He diagnosed me, treated me, and fixed my pain ready for the fight in 3 days' time. 30 minutes, and I was already ready to fight that weekend. Now, anyone else without my interest might have just seen that as a means to an end, i.e. they just went to see an osteopath, got no interest in the human body, but for me, I had quite an avid interest in the human body, and I could kind of work out what he was doing, and I wanted to try and do the same thing. Now, thankfully at the time, I was already taking 2 sciences for A-level, which was biology, psychology, and I was also taking PE. So when a year later, I had to apply to UCAS, it was quite easy or not, it wasn't quite easy, but I had the required subjects to get into university to study for osteopathy. Now, there's going to be some of you who have clear vocations in your mind, physiotherapy, radiology, psychology, possibly psychiatry. Does anyone, oh no, you wanted psychiatry first, right? You wanted to be a psychiatrist first, possibly psychologist. Okay, fine. Now, for you guys who don't know what you want to do at university, I would very much advise you that you pick, when it comes to your A-levels, the hardest topics that you think you can keep up with, and talk to your teachers about this. as to what would be most appropriate for you, to put you in the general direction that you want to go. And then for those who have clear vocations in mind, it will be better that you actually look at what the universities are requiring you to study and study those. Yeah? All right. So, becoming an osteopath. All right, so over 4 years, and this is what it's like to study osteopathy, we intensively studied more than I thought I would have to about the human body. What happens in the womb during its development, what happens to the mind when it is under stress or in pain, how your society or your social situation can cause you pain, physical pain, maintain your pain, predispose your pain. What makes up the body? How can you take a bone, and we would have models of bones or even real bones at university, and they'd be handed to us, and we had to feel them and tell someone what that bone is, where it comes from, where different muscles attach to each area. And it's a way that we will develop in our skills so we can put our hand on a body and feel that body and understand exactly what was going on underneath our hands. Right? We studied the body's workings, the mind's influence, the nature of pain, what pain does, why it occurs, and also processes of pain relief and pain prevention. How can we reduce that person's pain in a way that's convenient for them, and how do we make sure that that pain is far less likely to come back or doesn't come back at all? We learned techniques and knowledge to help people live a pain-free life, and this was split into 4 years. So the first year is how does the body work? Anatomically, neurologically, physiologically, looking at the lymphatic system, which drains toxins away from the body, looking at different bacteria that might live within the body, and how does this create a person that we might see on a day-to-day basis. Second year, how does the body break? What happens when all of these things or some of these things might go wrong? How do they present themselves? How do we examine and how do we test? Third year was when we started to treat patients at the university clinic. So we go into the clinic with supervision from the tutor of the older years, and this is the first time that we started to treat patients in our third year at university. So I would have been about 2021 at the time. And then the fourth year was treating patients writing our dissertation. So getting really good, or as best as we could be, at being osteopaths. But then as well as that, writing our dissertation. So researching topics which would have been relevant to the world of osteopathy or world of health at that time, and trying to extract new knowledge from them to present to our examiners. All right, now I've written a note here before we go on to more of the business side of things, which is what came, I suppose, straight away after I finished uni. I've written here about possibly doing a demo treatment. If any of you guys wanted to see what it's like to be an osteopath? Yeah? Okay. Joe, would you like to be one too? Joe, do you want to take... Sorry?
Is that sweet?
Sweet. Feel free to take it here, Shabbat. All right, so, Joe, have you had an injury recently?
My shoulders, actually.
Your shoulders,
playing
yeah?
sport.
Okay. What sport do you play, Joe?
All sorts. So football, basketball, ice hockey.
Okay, amazing. And you're a teacher, so how many hours a week do you reckon you're working?
Like before we go home, or?
Let's go for total.
Probably about 50 hours.
About 50 hours. And how many hours of sleep do you reckon you get?
6 to 7.
6 to 7. Okay. Do you feel rested when you wake up? Okay. All right, good stuff. So, your sports, Joe, are, what are your sports again?
Football, basketball, ice hockey.
Ice hockey. Amazing. All right, perfect. So, let's go through just a brief summary to start off with, right? So, we've got Joe. Joe, your aim is to be pain-free.
Yeah.
Anything else?
Just for not to hurt anymore,
Not to hurt anymore. Okay, perfect. Yeah. All right. So, we're going to go back to the concept of the hero story, right? Now, if anyone's got any questions, just let me know. So, we've got Joe before pain, right? Which would have been how long ago?
A
couple of years ago, right? So Joe before pain didn't know she could experience pain as excruciating as this in her shoulders, but let's have a look at the founding story for Joe. Joe loves to move, she loves to use her body, she loves to be as active as possible. So with that comes certain stresses. We get certain boosts of inflammation when we do exercise, body's going through certain stress. That body then needs a certain environment to recover. Now, if someone is working 50 hours a week, they are more likely, let's say, to be burnt out or to burning the candle at both ends than someone who's working maybe 40 to 45 hours a week, right? If that's the case, then it can predispose, I'm not saying this is you, Joe, but it can predispose their emotional budget. Emotional budget might be motivation, might be eagerness. That can start to deplete. And when our emotional budget depletes, which is relevant for you in psychology, psychiatry, and physiotherapy, we start to feel the world more, right? Who's gone through a period of time where we're a bit sleep deprived or overworked, and you tend to get ticked off a bit quicker? Or you tend to feel achy and stiff when you shouldn't do, you don't want to eat, or you want to eat more. These are all symptoms of our defense mechanism starting to drop down, right? We can't protect ourselves against the world, so we're starting to feel the world a bit more. Now that crosses over into pain. So for example, statistically speaking, if Joe had 7 to 8 hours of sleep a night, or 8 hours plus, and was working 40 hours a week, then her body will be more likely to be able to recover. However, Joe being a teacher and enjoying your sport, I'm not going to be able to say to Joe, you need to stop working as much, because I understand the demands of your work aren't going to enable you to do that, right? So you've got to work within the context of Joe's hero story, not mine. It's very important that I take myself out of this equation, and I'm looking to where Joe wants to go in the story. So, over the next, say, few months, Joe, what did you want to achieve?
To be able to have like more range of motion in like your shoulders and whatnot.
More range of motion in shoulders, and then pain to reduce as well. Perfect. All right. So, what we're going to go through now is we're going to go through an examination. So we're going to start off with a small picture. The small picture is how Joe's body is performing at this point in time and which areas are most tender. And then after that, we'll go through a diagnosis and then a treatment plan. All right. So, Joe, if you'd like to stand up for me, please. So I'm going to start off by having a feel. Now, by Joe's description, it seems like it might be the muscles or it could be the joints or both in her neck and her upper back, which is most sensitive, but it could also come to the rotator cuff as well. All right? I'm going to open up a program in a second to show you exactly what I'm feeling, exactly what I'm doing. So I'm just going to place my hands on your neck, Joe, and I just want you to tell me what is tender, if anything at all.
No, not tender.
Not tender. So you can see that Joe's got quite strong shoulders, strong neck. A little bit of tension here, but I don't know how that feels to you, Joe.
Just when you put pressure.
And how does it feel when I put pressure on?
A bit, but tender.
Right, so if it's tender or uncomfortable, and that's the areas that Joe is experiencing tenderness or discomfort, then it might be that these areas are on quite high alert. So I'm just going to show you what I'm feeling for. Stay standing if you can, Joe. All right. There's this program. This is a program that I use to educate our patients on exactly what's going on in their bodies so they know how we're going to be working. Alright, so the areas of Joe's back that I was feeling were the supporting muscles of the upper back. It's connective tissue. So we've got the rhomboids here. And we've got the upper fibers of trapezius. So upper fibers of trapezius is the cape muscle that goes over the neck and shoulders, heavily involved in not just power, but also stress. Because if we're stressed, we want to make ourselves look bigger for a threat, or we want to hide. So that's why the upper fibers of trapezius and neck can get really uncomfortable when we're stressed. Let's take this down a bit to the supporting muscles of the shoulder. So we're going to now go through some different tests, check these muscles, and check the functioning of the joints. So if you'd like to stand here for me, please. So we're going to start to load the joints in the neck. So from here, Joe is going to just look to her right, and just drop your ear back to me, Joe, and just tell me how that feels.
Just like pressure when you put my neck.
Right, and is the pressure here, or would you
More
say?
so like in the neck.
In the neck. So what we're finding is when I start to compress the joints in Joe's neck, that's causing a little bit of tenderness. You look to the left of me, please. Same thing on that side or less so?
Less so.
So even for myself, I can feel, and this is part of what we studied at university, is palpation, I can feel that the end range is softer here in comparison to here. That feels more guarded to me. That's called a Sperling's test, so we use it to check for compression in the neck. Now we can do the same thing for the upper back. So Joe, what I'd like you to do is put your hands behind your head for me, please. That's it, elbows together. And then from here...
Look, I'm getting rested.
Rested? I wouldn't know what that's like, Joe. From here, we're going to raise you up to here, and I just want you to tell me how that feels when I'm doing that.
So in my left shoulder, at the very, very top here, you feel it like pulling.
Okay, fine. So potential rotator cuffs, let's have a closer look at that. So hand to here, pull up for me, please. How's that feel?
Yeah, same. It's like pressure.
Right, so when Joe starts to activate her rotator cuff, sorry Joe, 2 seconds. Supraspinatus here, that's causing Joe pain. Sorry Joe, almost done. So then if we wind up that tissue a little bit more, so here, and then pull up for me please Joe. Same things. When I start to load it even more pain. If I take Joe's arm over and then do the same thing, does that get better or worse? Or is it about the same?
About the same, so again, just like...
About the same. So we want to make sure that the acromioclavicular joint, this joint here, isn't also inflicted. So from here, Joe, push out for me, please. Any pain at all there? Okay, so it's most likely going to be rotator cuff from that side. Step to the left a second. And then from here, push up again for me, please. How's that feel? That's fine. Thumb down, push up. All good? Alright, so to conclude, we've got a little bit of neck tension, and then we've got some pain going into the rotator cuff of the shoulder. So what we can do is go through a treatment to reduce this pain, and then obviously normally I would give exercises and advice to help Joe to reduce that pain at home as well. Are you happy for me to treat that for you now, Joe? Just to show him what I'm doing?
Yeah.
You sure? Are you happy with joint manipulation?
Yeah.
So I click a joint in your neck? Okay. Is that alright?
Yeah.
Okay, fine. The other thing I was going to ask is, do you have any history of osteoporosis or vitamin D deficiency, any thyroid issues or anything like that? Perfect. So the reason why I'm asking that is when we do certain treatments, they might have a little bit of risk associated with them, right? So we want to make sure that Joe is safe for me to treat. So what would be easiest to do? Do you want to take a seat here? Sure. All right, so we have the rotator cuff, which attaches to the suprascapular area of, the supraspinous fossa of the shoulder blade. So I'm going to show you that here. Here, it's the supraspinous fossa, right? So we've got the spine of the scapula underneath. It's going to go up onto that, fix it, and then from here, I can then start to use quite a harmonic action. I need to give you the full weight of your arm, Joe, to start to inhibit that muscle and reduce the amount of pain that it's causing Joe. So I'll do this maybe for 5 or 10 minutes. And then after that, I'll then move on to the muscles of the upper back as well. So you just give it the full weight of your shoulder. So here, I'm fixing Joe's shoulder blade and moving it in quite a harmonic way, taking the weight of it so the shoulder doesn't feel like it needs to protect itself anymore. But also, hopefully, that might feel quite relaxing to you, Joe. Yeah? Alright, so we're using this technique to reduce pain, but also to improve range of motion. So here, I've got my hand behind the shoulder blade, and I'm hooking my hand behind the shoulder blade to start to move it in a few different ranges of motion to reduce pain and to improve mobility. And then as well as this, we can then put some movement through the neck to reduce pain and to increase how free the neck is feeling. Now, this is a technique which is most often used by osteopaths and chiropractors, but some physiotherapists use it as well. Our physiotherapist at the clinic also uses it. So I'm just going to ask you how you feel first. So from here, I'm just going to take my ring finger and I'm going to place it on one of the joints that is causing Joe discomfort. And then from here, how does that feel, Joe?
As comfortable as it could be.
Okay. So from that position, I'm just going to give it a little bit of a pull. You might hear a bit of push or a pop. All right. So if you listen out. So deep breath in, Joe, and up.
Ooh.
All right. And that's one of the techniques that we use to increase range of motion, reduce pain. I hope that wasn't too uncomfortable for you.
No.
Okay. Feel all right? Thank you, Joe. Take a seat. All right, so that was obviously a very quick 5-10 minute centre treatment or example treatment, and just showing you, giving you a bit of an insight as to what we do at the clinic. But the most important thing is what happens outside of the treatment rooms. How do we help Jo with her quality of sleep? Certain teas that we can recommend before she goes to bed. Different environments of the bedroom to make sure that she's as relaxed as possible. How do we give her exercise to strengthen her upper back and shoulders so it's better able to deal with the demands of her work, right? Now, sorry, first of all, any questions before we go forward? Yes?
Yeah, I have a question. So like when you do this, isn't it like the bones, so like when you do, the bones come together, contact between each other, and there's like a cartilage between, so when you do this, because of the friction, can the cartilage like break?
Oh no. So first off, we have to respect how much the body can deal with, right? So just think that even for those of us who aren't really that involved in gymnastics or anything like that, right? Within maybe a few weeks of practice, you could probably be able to do a headstand, right? So you could probably load your neck with your entire body weight for a certain amount of time. And it's really important to remember how strong the body is when we're dealing with patients, because if we are habitually too conservative with our predictions or with our understanding of how much load the body can go through, then we can actually cause patients more harm. So for example, we at the clinic, we often get patients coming in and they will say, my doctor said I've got, so say if it's a 20-year-old patient or 30-year-old patient, my doctor said I've got the spine of a 70-year-old, or it's bone on bone. They say that I've got severe wear and tear, right? Now, if we go back to the concept of the mind that we spoke about before, we've got the conscious mind, we've got the ego, and then we've got the defense mechanism. Is that person going to be then in a defensive mode, or are they going to be in an optimal mode after hearing that? Defensive mode, exactly that. And if they're in a defensive mode, if they're anxious, then they're more likely to experience more pain. So just to answer your question, the body can deal with a lot of load. It's just making sure that we are preparing that body for that load, whether that is psychological or physical conditioning. When we manipulate, we actually use more traction than anything else, because what we're looking to do is that. So we're looking to open the joint, which is where you hear that. So if you imagine 2 panes of glass, if I put a little bit of water between those panes of glass, rub them together, and then it's going to stick, right? And then if I open up that vacuum, you hear, that's exactly what a joint manipulation is. Now, the benefit of that is you will experience pain relief, an endorphin rush. People feel, that feels good after. Endorphins are good for pain relief. But you also get a local reflex where the muscles relax and the joint goes through a large range of motion. That gives, say, Jo a window of opportunity where she can actually move her neck more freely in less pain, and she can start to rewrite that script. Jo's had a script going on in her nervous system for 2 years that this movement is painful, this movement is a problem, I can't do this movement. So if we start to rewrite that script, we start to rewire the neurological pathways that are going on around the area. Yeah? Any other questions? All good? All right. Does anyone have any aspirations to open a business later down the line? Is it attractive? Yeah? Okay, amazing. What kind of business do you want to open? So is that again, sorry?
Running one.
Yeah.
Having employees.
Yeah. Why is that?
I think it's just because I'm not a leadership person, and I like working with people, but I like being as the vocal.
The vocal person. Do you find that transfers onto the netball pitch? Are you captain at all, or?
I'm centre as well.
Centre. Okay, amazing. So the reason why I was asking is, do you see how Sophie might be extracting from her nature without her even realising it? So she's aware that she's vocal, that she's aware that she enjoys leadership. That is something which is within you, and it's probably been preordained. It's probably something that has been there since the time that you were born, or developing since the time that you were born. And throughout your life, you can dip in to that pool of potential in your mind and draw out something for society. So with that, we've got becoming a physiotherapist, we've got being a captain, or to say a centre in netball. But then, as well as that, later down the line, that's going to enable you to build a business. If you build a business, you pay tax on that business, so you put that tax back into the country. You employ people. If you employ people, you give them a salary, their tax on that salary, that puts back in. And then also you're coaching people throughout that, right? So there's nothing better or worse about any of our natures. It's just that we're unique. And the more that you can draw in to that nature and pull out for the betterment of society and the betterment of yourself, the better. Now, let's talk about the business side of things then. So, where are we? Okay, so quite like you, Sophie, I love competition. If I can go head to head with anyone and just be able to put my effort into it, I don't care whether I win or lose, I love it. So for me, opening up a business was quite a commonsensical thing to do, because it was a way for me to butt heads with competitors. It was a way for me to really fulfill my own potential without having to work under anyone else. Definitely not the right path for all people, but for me and for my nature, it was the right thing for me to do. So opening up a business has been described as jumping out of an aeroplane and having to build your parachute on the way down. Right? So it's quite a difficult thing to do. It's very, very time pressured, and it's very financially pressured as well. So what I mean by this is you have a great idea of this exciting journey that you're going to go on, but if you run out of money whilst you're trying to build a business in the process, that business is going to die pretty quickly. So it doesn't matter how good your ideas are, it doesn't matter what good intentions you have, if your business runs out of money, that is game over. That's also the reason why when we look at, say, a lot of individuals who have done very well for themselves, have we got enough time? Yeah. Who are doing well for themselves, a lot of them have come from a lot of money, because it gives them that longer process where they can be doing quite badly and still pull it off at the other end, right? Now, the only reason why I say this is I had a bit of a rude awakening when I started the business, because I was following these individuals as almost like a blueprint to success, but you realise that you come from a very different environment than they might have come from. It's very, very important that we realise where we are in space and in time before we partake on something which is going to be financially quite risky. Yeah. So my basic moral story is don't open up a business on a whim. Make sure that you keep your risk very low if you are going to open up a business. So I'd started a small sports massage business whilst I was studying. So I'd take a mobile treatment table and I'd go around to people's houses and I would treat them using sports massage therapy. But as I started to develop as an osteopath at uni, I would start to use my osteopathic knowledge to the betterment of my patients as well. Now, so I started a sports massage business under the brand of Rise whilst I was at uni, but I only had that's it. So when I graduated, I had developed a very small clientele, maybe about a few hundred people over about 2 years, right? I've about 250 people. And with the amount that I was earning for sports massage, I thought naively that I had enough money to cover the overheads of running the first shop front. I didn't, which meant that I was probably losing about £1,000 to £1,500 a month, and I needed to start to develop clientele quite quickly. I needed to get the word out. Now, if you guys remember about my childhood, that I liked learning about people who spoke truth to power, people who could put words out and make people change their minds. Whether that was the prophets that I learned of as I was growing up, whether it is the Muhammad Ali's and the James Baldwins of the world, these individuals historically have been able to speak truth to power, have been able to speak something and make someone change their mind or create an epiphany where they wanted to take action. So marketing, for me, was that channel for my nature. I love marketing, I absolutely love putting out creative things or interesting things to garner people's, to grab people's attention, and then once I've got their attention, to educate them or to help them, to guide them in a path forward for their betterment. Like I said, from the age of 9, I'd already been developing my interest in the mind. How do people make decisions, become persuaded, change existing belief systems? Reading book after book on marketing and business helped me to develop a marketing plan that worked. So from the first year in business, 2014, we were seeing about 1,200 appointments a year. So it's about, 100 a month. By the year 2016, we were seeing 2,900 appointments in a year. By the year 2018, 7,800 appointments in a year. 2020, 6,900 appointments in a year. That was during COVID, so that's why it dropped by 900. And in 2022, this year, even though the year hasn't ended, we've already seen 9,415 appointments in a year. So that's my ability, and obviously my team's ability to obviously do a good job, but as well as that, to speak about it and to educate people about it. We have 8,600 clients who have rated us above a 96% rate of being highly satisfied. A team of 19 team members, including osteopaths, chiropractors, physiotherapists, sports therapists, personal trainers, nutritionists, yogis, counsellors, and clinical psychologists. And I'm currently using my business knowledge to help other clinicians to open up their clinics in a joint venture. That's where next year we're going to be opening up clinics together. And I've been able to take a step back from treating as many patients, means I can do more things like this. So gone from treating 75 patients a week to now 15 patients a week, where I can support my team members more so, and I can look more towards what I want to put my hand to over the next 5 years outside of the clinic. Now, when it comes to our nature, so that's me and my mum outside the first clinic that I opened, and this is the second clinic that I opened. So this one's about 100 square foot. No, more than that. That was about 200 square foot, and this is about 1,500 square foot. It's much bigger. So we've got gym space in there as well, multiple different treatment rooms. That was one treatment room, but that was the day that I opened it with my mum there as well. All right, so our nature. So our nature will always find a way to express itself if it's given the chance. Your nature, your existing traits are going to be the most powerful things that you ever have as human beings. It's very important that you try your best to realise these. So far, my existing interests in the mind and the body and the spirit have formed a vocation. My love of competition and fighting helped me to form a business. And now, my search for what it means to be black has enabled me to discover my history or my ancestors' history, and which I'm now turning into a graphical novel and teaching throughout the country, especially around the southeast. One of the hardest things that you ever have to do in your life is lie to yourself, especially if it's on a regular basis. Now, lying to yourself can be a form of a meaningless sacrifice over time, whether that is for and putting effort and money into this, right? Or whether you're doing it for effort and money. So lying to yourself might be doing something that other people have told is going to be for your betterment, but once you're in it, you can't find meaning in what you're doing. It's a very stressful place to be in. Another example might be where, I'd say that would be the best example. You might have experienced that sensation before, that deep internal conflict where you feel this isn't me, this isn't what I want to do or what I'm about. Now, it's very important that if you do feel that, you don't just jump to an easy option, you jump to the hardest thing you can possibly do, which does align you and does align you within your nature, right? I'm not saying that this is going to come quickly. I'm not saying that if you do it for a day and you realise that it's not for you, that you should stop. You should try something thoroughly and try and find every avenue to try and make it succeed before you decide that you're going to move on to the next thing. But doing something that you hate with no end in sight can be a real form of misery. And you have plentiful amounts of time on your side. If you took until you were my age, you probably think I'm quite, I don't know if I'm a bit old, but even if you took until you were my age to find out what you really wanted to do, you're still going to be plenty young. You've still got about 40 years of work left. So it's not a big deal. All right, so take your time. These are fine, yeah, so if you were to, say, find yourself in a position where you're in conflict or regret, these are fine temporarily, or if you can find meaning in the execution, i.e. if you can learn to love it or learn to channel your nature through it, that's also a really good thing as well. i.e. you might not like maths, but maths flexes your brain, builds applicable skills, and is sought after by employers and universities. So you can go through 2-3 years of pain to get to where you want it to be. There are plenty of topics that I had to study at university that I didn't quite enjoy, but I knew that I had to get through them to get to the other end. And many things you can find meaning in where there wasn't meaning before, i.e. growing into a job role, finding ways to transfer your nature to the least meaningful of roles. But if you can't, then 50 years of meaningless work can become a very, very heavy burden to carry. Observe your mind and try your best to understand its true nature. What is it good at? What could you become better at? What do you want to become better at? How can you use these traits to better society? And the last few are key lessons that I really want to leave you with today. The key lessons from today's talk is the following. So first of all, work transfers the uniquely crafted qualities from our mind into society. Work is one of the best things that you could potentially do in your life. It fills us as a species with huge rewards to work at something for the betterment of ourselves or society. Observe yourself, observe your mind, and see what is within you that you could use to help other people. Develop your nature like a martial artist develops their ability to combat. very well-known philosopher who was also a Roman emperor called Marcus Aurelius said that life is more like a wrestle than it is a dance. There are going to be plenty of times in your life where you feel that you've been beaten down, where you're tired, where you're frustrated. It's completely normal. Make sure that you've got your respite, but also make sure that you're coming to fight. Make sure that when you do something hard, you're coming to fight. When you do something that you want to extract reward from, you're coming to fight. Build a relationship with your effort and your skill at all costs. The only thing that you have absolute control of is your effort. Make sure that whatever you do, put the most amount of effort that you can possibly put into it. You can control your effort, but you can't control the outcome. I love reading Stoic philosophy. There's a Stoic, let's call it, analogy of the Stoic archer. So imagine an archer. An archer is lining up for a shot. The archer is well slept, well fed. They've done all the training they need to take this shot. And as they're lining up to take this shot, they take a deep breath, they exhale, and they let the arrow go. Now, that archer was only in control up until the moment that the arrow left his bow. If the target moves, if it's blown off track, if the weather changes, for whatever reason, the only option that archer has is to take another shot. And that's exactly how life is. We can make sure that we're as prepared as possible, that we're well rested as possible, that we've got the necessary skill set. But if things don't work out the way you expect, you had no control over the outcome, take another shot. You're not in control of who marks your exam papers, you're not in control of what examiners think or what interviewers think, you're not in control of it. Just focus on what you can control and take another shot. Your life is your own private hallucination. So when they have conducted experiments on the brain and conduct experiments on our perception of reality, they found that we essentially hallucinate. So we're this brain which is rocking around in this bone skeleton. So to create a concept of the world, we have to hallucinate it or imagine it. This isn't something that we do consciously, it's just something that happens. But considering that our perception is an hallucination, make sure that you do your best throughout your life to make your hallucination a bad one. Oh, sorry, a good one. A good one. Step into the unknown and make it the known. So step into the unknown of a new university, a new workplace, a new work role. Step into the unknown and make it your own, applying as much effort as you can. I hope that today has provided you with a bit of guidance going forward. It's been my pleasure to talk with you today, and if any of you have any questions, then please feel free to ask them.
Any of you have questions? Because I know some of you asked about like different roles, and when we did like this Google form, you put what you're interested in, hence why you're like here today. So all of you who put your interest at his clinic, he does. So whether you're year 10, because some of you are going to be looking at work experience, it might be worth asking a question, to Elliot here as to, is there any opportunity there, or is there somewhere in and around that maybe he knows? You know what I mean? Because you need to find your own work experience. Yeah, that's not, unfortunately, something that we do for you. So being here, that gives you an opportunity thinking like, well, I know he spoke about osteopathy, but he does have counseling, he does have, massage therapy, he has sports therapy, he has all these things. And if you go on his website, you can see all his staff and what they've essentially have done, like what their degree is and what their speciality is. So please, because he's in the flesh at the moment, please ask him a question about anything to do with what your interest is, because like what you've asked or what you're interested in is, he can answer.
I can go through, yeah, go on. Yeah, of course, no problem.
Thanks for the question, Sophie.
When it comes to what you've already explained, I think to be a radiologist, that's a medical qualification, isn't it? So you go,
yeah,
so you.
From medicine to that.
So
So we do medicine first and then go to the.
That's it, yeah. So we're the same as yourself. You want to study to become a psychiatrist, so you do your medical qualification first, and then you'd have your placements. Right? So you'd have a placement as well. So you're placed when you become a junior doctor. Correct me if I'm wrong. Yeah, and then after that, you then start to train to become a consultant. So you become a consultant radiologist. You'd interpret graphical findings from certain examinations, right? Yours would be different. You would go into, you'd start to train to become a psychiatric consultant. So you'd go through quite aggressive education on the mind of certain mental illnesses, but you'd also be taught therapeutic techniques. So it might be that you're taught CBT, cognitive behavioural therapy. So it's ways that you can help someone to change their perception. So, for example, if we were to put someone's mind and body into an MRI, when they're stressed or they're excited, there's no difference. The only difference is the interpretation of the moment. So CBT helps you to help someone else to change how they see the world, right? But you'd also be trained on how you can medicate someone who is mentally ill. So you'd be seeing a lot of people who might have clinical depression, bipolar, borderline personality disorders, people who are suicidal, people who are schizophrenic, all kinds, right? Now, that is more of an allopathic method. So allopathic would be, that's the disease, here's how I'm going to treat it. But then you've also got the therapeutic method. So I'm more of a therapist. So a therapist would be, I'm with this person's with me, I'm an expert in how to get people, say, out of mental distress. This person is an expert on their mental distress. We're going to go on a journey together, and they're going to tell me about them, and I'm going to tell them how I can help them, and you're going to go on a journey together to reach betterment. So that is more of what a clinical psychologist would do, or a health psychologist, or what a counsellor would do. The clinical psychologist would work with very, very distressed individuals, people who might be sectioned, they might be in hospital because they're in so much distress, and the counsellor would more deal with people who are they're in society, but they might not be functioning as best as they can in society. So you can make up your decision as to whether the severity of the people that you want to help. Really, that would be, I think, the best way to weigh it up. Yeah.
Anyone else have any other questions?
Like, what about the work experience, like you did to get into the health?
To become an osteopath or to become...
Yeah, to the
So, to become an osteopath, your work experience is actually taken care of at uni. So you have to develop 1,200 hours. You have to accumulate 1,200 hours of patient time. So being with patients, treating patients, right? If you wanted work experience to see what it's like to be an osteopath, then feel free to contact the clinic, and we'll do our best to fit you in. Osteopathy is going through some really interesting changes. There's a massive recruitment of osteopaths into the NHS, which is increasing. Osteopaths tend to qualify at band 6, whereas physios will qualify at band 5 and have to work to band 6 musculoskeletal, whereas osteopaths can go straight into NHS at band 6, which has certain benefits. But as well as that, there's a drive to build bigger clinics within the UK. And I'm on the board of the Institute of Osteopathy, so that's a counsellor in the Institute of Osteopathy, so that's one thing that we're trying to do at the moment. But there are plenty of options, and I would say just make sure that you do what is the hardest thing that you could possibly achieve. I think that will give you as much reward as you would like. Yeah.
Anyone else have any questions?
I have one more.
Yes.
So you mentioned about the mentors.
Yes.
So how did this help you?
The mentors.
Yeah, the mentors.
Did I say about mentors? Oh, mentors in the hero story.
Yeah.
Who was my mentor? Is
Yeah.
that what you're asking?
Mm-hmm.
Yeah. I'd say my mentor is probably the books that I read. The authors of the books that I read. So that would be one of the most interesting books that I've read. So I would say, yeah. Okay. So growing up, it would be reading Malcolm X's biography was just the most impressive thing I've ever read. I don't know if you know who Malcolm X is. So Malcolm X was African American, grew up essentially a criminal in Harlem, right? So he was a drug dealer. He was sleeping maybe 3-4 hours a night, but he was very much aware of the racial injustice in America in the early 20th century. He was burglaring houses, and he was burglaring houses and he was caught burglaring houses for committing burglary, which should have maybe given him a prison sentence of about 2 or 3 years. But the judge and the police found out that he was seeing a white woman, so they gave him 10 years instead in prison, right? So in prison, he then started to learn about Islam, and he started to look within himself for betterment. He started to become a better person, and he wanted to help other African Americans become better people themselves. So after going to prison, he stopped drinking, he ate plain food, He practiced a very, very clean life. The FBI investigated him and said that he's probably the cleanest man that they've ever read about or ever examined. And he led essentially an intellectual and psychological renaissance of African Americans, and he uplifted the pride of black people all around the world. So that was my first, I'd say, mentor. I'd read plenty of books on Muhammad Ali, and then as well as on how to run businesses. The best books I've read though have been on the mind. How does the mind work? Because I think if we can change our perspective, and if we can improve our perspective, we can improve this brilliant thing which we've inherited between our ears, then we can make the world a better place. So best books I've read be books by Carl Jung, one of the earliest psychologists. There's a book called Denial of Death, which really shows us how our minds are constructed. Going back to, I'd say, the Bible and different interpretations of the Bible and the Quran and the Torah, and even reading a bit on the Guru Granth Sahib is really interesting to me how theologians and prophets throughout time have tried to understand the mind and the mind's relation to the world and non-worldly things, and trying to pick wisdom from that, I think, has also been one of my biggest, my most rewarding things. But I've had people around me who have started up businesses, who are psychologists, other osteopaths, and talking to them is really helpful as well. So that was a really long answer to your question. So, any other questions?
Could you go into a bit of depth about herbal remedies?
Yeah, of course. So, we have a Western herbalist, right? Now, what she does is absolutely fascinating. I've had patients, because when she first came to the clinic, and she's like, I want to start up a patient list, I was a bit doubtful. I was like, I haven't heard of this before, so send me over for a few things, right? Anyway, so she sent me over some documents and some research, and essentially what they do is, in allopathic medicine, you would take a chemical, i.e. a drug, and it's been created in the lab, and you would test it under controlled conditions to see whether it works or not. The Western herbalists just do the same thing for herbs, plants, foods, things like that, right? And the results are incredible. So, first off, I had sent a patient to her who had eczema all over her body, and within 2 weeks of seeing her, the eczema had gone. I had another patient who had sinusitis. Do you know what sinusitis is? It's where, so your head, it has a lot of hollow areas. So behind your nose, for example, is hollow, that's a sinus, and it has mucus around it. Now, this patient was in so much pain that she was waiting on surgery. The surgery is not very, a lot of the time it's not very successful. They have to drill into your sinus, they have to clear it out. Very, very painful. Within a few weeks of seeing Yulia, didn't need surgery anymore. For myself, I'd probably since the age of 22, 23, for various reasons, I've suffered from what you might call chronic low-level depression, which is where my default moods are quite low. Feels like the world is very dark and I have to do a lot to pick it up. So whether that is work or exercise or whether that is philosophy, etc. And it got to the point where I think it was about a year ago, I said to Yulia, I said, something has to change because I'm doing everything as best as I can and I'm still feeling incredibly low. I find it very difficult to motivate myself, very difficult to feel happy and to feel joy. She gave me a tincture. Within 2 days, my moods have been elevated ever since. And rather than have gone from, say, a -2 or -3 to now a +3, +4 on a daily basis. And it's all things that just grow from the ground, St. John's wort, rosemary, things like that. So that's what she does. There isn't as much recognition as I'd like for herbalists at the moment. People are more likely to go for the default, like medicine and things like that. But what they do is absolutely fantastic. Long degree, hard degree, but the rewards are amazing. The other thing I would definitely suggest actually is, especially with the world is a much better connected place now. So say if you did go down that route, I would start a social media following very quickly based on what you're doing. And then by the time that you graduate, you might have a following where you can then start to work, with a lot easier. Because most of her work she does online. Yeah. No problem. Any other questions?
Last question at all? Because you'll need to listen to as much as you'd love to stay here.
Yes. So my sister-in-law is a clinical psychologist. So it'd probably be better that you contact the clinic. Say I've spoken to Elliot, and Elliot said that he can help me with psychologists work experience. What can I do? And then I'll just talk to Leah, and then she'll get in contact with you, or I'll help you as best as I can. Yeah?
Right. Can you give a round of applause?
Oh, thank you.
Oh, thank you so much.
Good. Appreciate it.
All right. Can we go to lesson 2, please?
Oh, still going.